My name is Avidon, and I'm part of the Life Sciences Organization of UK Trade and Investment, and I'm based in Boston, Massachusetts. And today I'm going to give you the 5 critical issues you need to know when selling into the US healthcare market. So the first thing you need to know is that it's a very big market. The value of the healthcare sector alone is bigger than the whole of the UK GDP. So the US spends $3.2 trillion a year on healthcare. The total GDP all in of the UK is about 2.38 trillion pounds. So it's an extremely big market, and companies that are looking to enter the market really need to be wise about the geography and to really be thoughtful about where they're going to focus their efforts when they enter the market. So you need to understand it's a very complex and it's a very competitive environment. 6 out of the world's top 10 medical device companies are headquartered in the United States, and there's lots of competition. So if you have an innovative technology, we see there's lots of competition from Germany, Israel, markets like that. And if you have a commodity type product, you'll see that there's a lot of competition from Asia. So for UK companies that are looking to enter the market, you really need to think about how you're going to differentiate yourself. The big challenge with differentiating yourself is that if you want to enter the market and you are trying to present yourself as having something truly novel and truly innovative, what that means is that you're going to go through a much more complex regulatory and reimbursement pathway, and so then that's going to disadvantage you. But if you go in saying my product is substantially equivalent to something else on the market, then it's going to be hard to then get the premium pricing that you want to enter the market. So there's a real tension there. As a result of healthcare reform in the US, there's been lots of consolidation both in the health service, but what we're also seeing is that in the medical technology space that there are lots of mergers and acquisitions happening because companies are now wanting to own care pathways. So you're really seeing is that if someone's in diabetes or even long-term care, you're now seeing companies coming in that are offering end-to-end solutions. So it's not just about products. Often there's a service wrapper or something that's about what value is being delivered. So be very aware that if you're entering the market, often you're going to be up against a fairly well-oiled machine that's going to have a service element, warranty, service. You know, when I say service, I mean a service wrapper, but also service in terms of if the technology isn't working within 24 hours, within 5 hours, someone will be there to fix it and so on. So there's a very high expectation around customer service as well as outcomes and so on. So a real shift towards emphasis on value. Companies that are entering the US market, one of the biggest issues is around the funding, that companies that are looking to expand anywhere internationally, before you think about entering the market, really think that you've got enough funding to support your scale up and expansion, really looking at changing regulations. So if your technology does need FDA approval, really you're going to need to be aware of what the costs are. You're going to need to really understand how your technology is going to be paid for and who's going to pay for that. So again, when you're looking at the key themes in the US, all of you would have heard about health reform, and the big focus on health reform is really around cost, quality, and access. Previously in the US market, there were around 40 million uninsured Americans. As a result of the Affordable Care Act, it was mandated that insurance coverage was provided through what's called Medicaid expansion and so on and so forth. So now many more Americans are getting care. The problem is that it's very focused around value-driven care, and what does that mean? So we're seeing, the focus on cost, quality, and access. But there's another piece in that, and that's convenience. So the big thing that patients want isn't just quality care, but it's convenient care. People want the care delivered where they want it, when they need it. So the whole shift towards personalization, you look at these wheelchairs, you look at all these technologies, it really is about a target customer of one. What does that person want? The US is willing to pay extra money, but they want, the care delivered in the way they want it, where they want it, and so on. So just be aware of how your technology is going to offer convenience, cost, quality, and access. So what you really need to know when you're entering the market is who's actually going to pay for your product and technology. In the assistive technologies area, basically the government, most of the payment is by private payment by the consumer. The government, which is responsible for about $1 trillion, a group called the Centers for Medicare and Medicaid, they serve people that are 65 years and older, or people based on financial need. Centers for Medicare and Medicaid, as a payer, will pay for assistive technologies, but not for all assistive technologies. So they will pay for assistive technologies if there's a valid medical need or an injury or an illness. So if you're wanting an assistive technology just to help support you walking, or it's an app that you want to use, a knowledge-driven assistive technology, it's unlikely that the government will pay. But the government will never pay outright. It's going to be an out-of-pocket payment. So when you're thinking about who's your customer and who's buying and who's paying, it will be reimbursed at a federal level. There might be some funding at the state level, but the people that you really need to influence is going to be the consumer. And so how do you start getting to 320 million consumers? So this is how the health market is broken out, which about 50% of the healthcare spend, as I said, is the government payer. So that's Centers for Medicare and Medicaid. It also covers Veterans Health Administration, which is, if you're in assistive technologies, you will be wanting to work with the Veterans Health Administration. That would be a big market for you. But in essence, but the rest is the private market. The private market is funded by employers. So how it works is that if I'm employed with an organization, my company will pay for health insurance. And to give you an idea, it costs approximately $20,000 a year to insure a family of 4 in the United States, of which the employee will probably pay around $5,000 and the employer will pay around $15,000. So really big employer-sponsored healthcare, and be aware of that as well, because as you're looking at who's going to buy new technologies, employers are getting much more interested in the health and wellness agenda because they're trying to keep some of their healthcare costs down. All right, so trying to understand who's who in the provider environment, who are you likely to sell to, because again, the key thing you need to be aware of is who is the person who is going to want to buy your technology is going to be different to the person who pays for your technology, who's going to be different to the person who uses or benefits your technology. So be aware of all the different stakeholders. So, you might be selling into a long-term care facility, you might be selling into a home health agency if this is, if you've got an assistive technology for the home. But you really need to understand that, if you're selling into that group, what do those people care about? And again, I've talked about the value-based care. There's a real shift now towards paying for activity to paying for outcomes. So if you have a solution that will reduce hospital admissions or will help reduce the number of visits that a care services team has to put in the house, because if you've given someone a wheelchair, which means that they can get around with more ease than without it, then you've released costs in the system from having a home health nurse having to go and visit. So be aware of the cost consequences of introducing your technology into the market. So again, we've talked about who are you going to sell into and what's going to drive success. So I think it's really being aware of, who is your customer, what problem are you going to help solve. So, if you're working with a distributor who has got an Israeli company, a German company, a UK company, and 4 American companies, and you're trying to persuade that distributor to carry your technology, you want to know what that distributor wants to make a margin. That distributor wants to know that you're giving him the messaging and support so he can make a profit off of your technology. So you want to work with the distributor to help him make money, which means where's an easy value proposition, where's the buy-in, and so on. So just be aware the return on investment, knowing the key sales cycles, and especially knowing your competition. So, all too often our UK companies come into the US market and they have a perception, oh, well, this is going to be easy to sell. Everyone would want this, this should be easy to do. In the area of assistive technologies, be aware that many people are concerned that if this equipment was manufactured in the UK, well, if a part breaks down, how easy is it going to be to get that part replaced or changed or so on? So, what about, assurance of supply, warranties, really just knowing that the UK company isn't going to go out of business, So again, when you're selling into the US market, customer service and support is really a key thing in the assisted area. Again, knowing your strategy. So before you enter the market, do you understand the device? Who are the key influencers? What are the key risks? Really understanding about your regulatory pathway. For example, a basic wheelchair would be classed as a Class 1 device, but a powered wheelchair is a Class 2 device. So understand, that the Food and Drug Administration work of a system of they look at risk and controls, so they want to know what's going to be the risk to the patient of using your device. And so just be aware of, do you need the approvals and allow enough time for that approval? In terms of reimbursement, do you understand the reimbursement landscape? So how is your technology going to be paid? The Centers for Medicare and Medicaid, which is the biggest procurer, once a year they do a procurement called DME POS, which is durable medical equipment, prosthetics, orthotic supplies. So all they care about is that if you have a wheelchair and you're wanting to sell your wheelchair into the US market, so that would mean the Veterans Health Administration or people over 65 or people based on financial need, there's that one procurement that happens once a year. And if you're not on that schedule, if you don't get selected, and it's pretty much by price, then you're out of selling into the public market. So then the only route in is private pay or private insurance. So really understand the procurement cycles and the reimbursement, and then know how your device will be distributed. Who are you going to be working with? How are you going to support that distributor? Are you going to sell direct? If so, do you know the cost consequences of hiring a sales force and so on? And then the key thing is knowing how to pitch. And for many UK companies, companies like to go and to tell a story. Well, my grandmother had this condition and I then went into my garage and I created this technology and this is why everyone loves it. And all the US person is like, what's in it for me? So they just want you to get to the point and say, okay, how am I going to make money out of this? What kind of support are you going to offer to sell this in? What are the margins and so on? So just be aware that they're very different styles, to adapt and adopt when entering the US market. So again, it's really getting a sense of, who controls the budget, really about these cultural differences, and really practice your elevator pitch, because if you've only got a few seconds to get someone's attention, know what's going to get their attention. So if you say, my technology will help reduce your hospital admissions, my technology will free up your nurses' time so your nurses can see more patients when they're doing home visits, my technology can do this, that's the language that they will understand, rather than saying, my wheelchair has got 5 gears. They couldn't care less, or they don't care whether it was developed out of your grandmother's garage or whatever. So just be aware of that. So as a final checklist, things that, for you to just be aware of: have you defined the market? Do you know how your solution sits into a care pathway? Do you understand the needs of your buyers? Do you know that the person who's paying for it and using it and prescribing it, if you will, so just be clear of the market. Do you know where the value is going to come from, where the ROI is going to come from? Do you understand your competition? Again, the US market is a very competitive market. So just be aware of what you're offering that the local market can't offer, knowing your pricing, no distribution. Really the implementation and support model is critical when it comes to guarantees, warranties, servicing, parts, things like that. If you've got a wheelchair or so on. Product roadmap, so you might start off and you're looking at the northeast of the country, or you might be looking in Florida because that's where all the snowbirds go down, to the southern part of the country. So if you've got an assistive technology, you might start in the Florida area, but then what's your plan for scale up? Who are you going to be working with? What assets are you going to leverage along the way? Again, sufficient financing to ramp up and scale up. Your customer service plan, economic drivers, and again, really who's going to pay and why. So all in all, it's fairly simple. The good news is that UK Trade and Investment has got offices across the United States. We've got 9 posts, and in each of those posts, there is a person, a commercial officer or an investment officer, but there's someone there that can help you. We have got specialists that can help navigate your way, and the benefit of working with UK Trade Investment is that you can really take advantage of government financial support. It'll help you scale up. So if you want to do a product launch at one of the embassies or consulates around the country, we can help you with a product launch. There's a whole range of services, and the most important thing is that our targets are aligned with your objectives. So your objective is to win business and do deals. Well, we're measured on the amount of business won and number of deals done. So there's a very close alignment between our targets and your targets. So really would encourage you to reach out to your UKTI counterparts.